Hi, welcome to the BoonDOCS Wilderness and Travel Medicine Show. I'm your host, Dr. K.
And I'm DJ Thalen, Chief Field Operative.
Today we're going to talk about one of the most ancient and feared of all diseases. A disease that potentially affects animals, children, international travelers, field biologists, spelunkers, veterinarians like my wife, hunters, trappers, taxidermists, even laboratory personnel working in close contact with animals. A disease where infection leads to death in virtually 100% of cases, even though a perfectly good vaccine has existed since 1885. That's right, we're talking about rabies, but unlike the movies where the story always ends on a sad note, we're hoping that education, preventive medicine, and good old-fashioned common sense prevail so that you and your companions, four-legged or otherwise, can keep from contracting this universally fatal but otherwise preventable disease. The name rabies itself is Latin for madness. It may also be related to Sanskrit Rabhas,
Which means to do violence.
Specific references to rabies date as far back as 4,000 years ago, when in ancient Mesopotamia, the law of the land dictated that owners of dogs showing signs of rabies had to take protective measures against bites. If a person was bitten by a rabid dog and later died, then the owner of that dog was fined heavily, 2/3 of a mina of silver to be exact. Jump ahead 4,000 years when Aristotle first discovered that dogs could transmit rabies to other dogs through bites. Later, a Roman encyclopedist by the name of Aulus Cornelius Celsus suggested cauterization, or burning, of bite wounds to help prevent the spread of infection deeper into the body.
Unfortunately, that was the best medical advice out there, at least until 1885, when the famous microbiologist Louis Pasteur successfully produced the first form of a working rabies vaccine. He did so by growing the rabies virus in some unlucky rabbit's spinal cord. Then he weakened the virus by drying out the infected tissue for several days. He barely had time to test his vaccine before he was asked to treat a 9-year-old boy named Joseph Meister, who on July 6, 1885, had been badly mauled by a rabid dog. Pasteur was not a licensed physician and faced criminal prosecution if things went south. Luckily for everyone, the boy was treated and did not develop symptoms of the dreaded disease. Pasteur was hailed as a hero, and the first of the Pasteur Institutes was built on the basis of his remarkable, if not gutsy, achievement.
Pick up a medical textbook and you'll learn that rabies is a ribonucleic acid virus in the family Rhabdoviridae. Perhaps reflecting its lethality, it actually looks like a bullet under the microscope. Rabies is found on all continents of the world except Antarctica. But unlike other viruses that affect us, rabies is not known to be passed from human to human through the blood. Instead, rabies usually gets inoculated into a bite wound through the saliva of the infected animal. Amazingly, saliva can contain up to 1 million virus particles per milliliter, so even a little bit of saliva can be loaded with the deadly virus.
All mammals are potentially susceptible to rabies, but specific animals known to more commonly transmit the virus on a worldwide basis include the following usual suspects: dogs, foxes, wolves, raccoons, skunks, mongooses, jackals, and bats.
Bat bites anywhere in the world should raise concern for possible rabies exposure. This includes waking up to find a bat in your room. The problem here is that bat teeth are so tiny and sharp, people have been bitten in their sleep without even knowing it. Because human contact with these other animals is overall relatively limited, and since dogs and cats are more likely to interact with animals in the wild that could be potentially rabid, it's most important to vaccinate our own pets and keep them current on their vaccinations.
If they're not vaccinated, they could potentially become exposed and infected with rabies from wildlife and bring the virus back into contact with ourselves and our families.
In Africa and Asia, dogs remain the most common source of infection amongst humans. In Latin America, where dog rabies has virtually been eliminated through successful vaccination programs, vampire bats remain the most common cause of death. Once a human being or other animal gets inoculated by a bite, the virus spreads from the muscle tissue to the nerves connected to that muscle. From there, it's a straight shot to the central nervous system, or in other words, to your spinal cord and brain. The rabies virus can travel at a rate of about 3 to 10 millimeters an hour. That may not sound Jimmy Johnson fast, but it can make a huge difference in time depending if you get bit on the foot and have to travel this far to the brain, or get bit on the face and only have to travel this far.
Once it gets into the central nervous system, the rabies virus spreads along the nerve cells until it gets to the brain, where it multiplies and then travels back out to the rest of the body.
For most reported human cases, the time from infection to the start of clinical symptoms varies from 2 to 16 weeks, though it's been known to take as long as several years and as little as 9 days before any changes could be noticed.
Initially, you might feel a little more tired, a little more irritable or anxious than normal, but trust us, your morning cup of coffee is not going to make a difference this time.
You might even develop fever, headache, nausea, vomiting, other symptoms that pretty much mimic the flu. If you're lucky, you might develop pain, itching, or tingling at the site of the bite as a warning sign of early rabies, but that only happens in about half the cases. And if you wait that long to get treated, you're probably not going to survive. Within 2 to 10 days, the neurologic symptoms begin to develop. In humans and other animals, the disease now usually starts to take on either one of two forms. Contrary to movies like Cujo, dogs most commonly develop what is known as paralytic rabies, characterized by progressive paralysis without increased biting behavior.
Human beings are at risk for contracting rabies while caring for victims or animals through exposure to saliva, so pay attention to these red flag signs. Damage to the cranial nerves can cause 1. An animal's tongue to stick out abnormally far, and 2. Unusual sounds because of involvement of the throat muscles that control vocalization.
Humans are more prone to developing what is known as furious rabies, characterized by unusual responsiveness and alertness. Later, victims become unresponsive and restless. They grow overly sensitive to sounds or touch. Behavioral changes begin to take place such that victims that normally avoid direct association with humans, foxes, skunks, and raccoons for example, appear unusually friendly and approach people without fear. Victims may also start foaming at the mouth due to increased saliva production and the inability to swallow. They may also start acting differently than usual. For example, normally friendly dogs and cats may begin to bite, which is the way this virus survives in nature by getting passed from one victim to the next, and normally aggressive animals may act very friendly. These periods of increasing agitation, hyperactivity, seizures, and violent outbursts are often interspersed with periods of calmness. Hallucinations are also possible, and in between these fits, the victim is often aware that death is near. Pharyngeal spasm of the respiratory muscles and subsequent choking may occur when the victim tries to take a drink of water, a reaction that may be triggered merely by the sight of water, a peculiar phenomenon that has given rise to the term hydrophobia, or fear of water. Hydrophobia is a symptom that has been reported in humans and is not necessarily present in animals.
No matter what form of the disease an animal or human contracts, it all ends the same way.
Eventually, rabies victims go into a coma and die. The specific cause of death is usually heart failure, irregular heartbeat, or from pneumonia or overwhelming systemic infection.
Amazingly, even in this day and age, the mortality rate from rabies infection is virtually 100%.
He's not exaggerating. Only 3 people have ever been known to survive a rabies infection. Trust me, you don't want to play those odds. And you don't have to when you consider we have working rabies vaccines that can prevent you from getting infected in the first place. So what do you do if you've possibly been exposed to rabies virus?
First, you get yourself and others away from the attacking animal.
Step 2, immediately wash and clean the wound as thoroughly as possible, since even basic wound care can help reduce the risk of actual rabies infection.
Next, get yourself to a local emergency room or a physician office if there is one, for rabies prevention management.
Now here's why vaccination before you're exposed to the rabies virus is so crucial. If you were smart enough to get vaccinated in the United States, you probably received 3 intramuscular doses of vaccine, like a flu shot. This could be done with either the human diploid cell vaccine or the purified chick embryo cell vaccine. Congratulations, you did yourself a huge favor.
Sure, pain, redness, itching, and swelling at the site of the injection are common side effects with the vaccine. So are headaches, nausea, fever. But those minimal pains and side effects are nothing compared to what rabies can do to you.
So because you were already immunized, you simply need 2 booster doses of vaccine.
If you did not pre-vaccinate, your treatment protocol is going to be much more complicated and come with significant risk.
In this case, you'll have to start with 4 doses of vaccine given intramuscularly over just 2 weeks. You have to be careful though, because there are some countries outside of the United States that continue to manufacture their vaccines from viruses grown in animal brains. According to our Centers for Disease Control and Prevention, you should not accept these brain-derived vaccines.
So how do you know what is a brain-derived vaccine?
If your treatment protocol requires once-a-day injections for 14 to 21 days straight, you need to find another medical facility where the HDCV or PCEC vaccines are available. Sometimes that even means having to leave the country, and remember, the clock is now ticking. In these cases, travel and evacuation insurance can help, but it is easier and safer to get vaccinated before you travel in the first place. In addition to all this, the unvaccinated rabies person also needs to receive rabies immunoglobulin at a rate of 20 international units per kilogram directly injected into the wound site itself. If you were previously vaccinated, you do not have to and should not receive rabies immunoglobulin. This is another major advantage of pre-exposure vaccination.
Why would you not want a rabies antiserum? Because of the known reactions when horse antibodies are used and not well purified. They can cause a severe allergic reaction and death completely separate of the rabies virus itself.
Importantly, because rabies vaccine is a life-saving vaccine, pregnant or nursing mothers should still receive rabies prophylaxis if they've been exposed.
And anti-rabies titers should be checked in individuals that are immunosuppressed.
Now, if you're wondering what the treatment is for someone who's been infected with rabies, you've missed the point entirely. There is no treatment. You make infected individuals comfortable and provide for intensive care support of vital functions until the inevitable occurs. Rabies is not a forgiving disease, and there are no second chances. So do yourself the favor and get vaccinated before you're exposed. Now, as a pediatric specialist, I would be remiss if I did not mention that children are a special population when you're talking about rabies. Consider that their small size makes extensive deep bites more likely. And because up to 60% of all human rabies deaths occur in children less than 15 years of age. Kids are also naturally more inquisitive and drawn to animals, which can get them into situations that adults should know how to avoid. Likewise, kids may simply not know to report an exposure or think they'll get in trouble if they do. According to our Centers for Disease Control and Prevention, rabies vaccination is indicated for certain travelers and specific groups of people deemed to be at higher risk for rabies exposure. Check with your physician to see if rabies vaccination is right for you or your family members. And remember, your animals can be vaccinated by your local veterinarians as well. Well, that's it for this episode of BoonDOCS Wilderness and Travel Medicine Show.
As usual, share this information with others in the field. And remember,
When you're out there, be there. See you next time on BoonDOCS.